Welcome to the CloudCare Podcast, where we ignite impact in behavioral health and human services, one conversation at a time. Join Bob Bates, CEO of ContinuumCloud, as he explores the evolving landscape of behavioral health, uncovering the latest trends, challenges, and innovations shaping the future of care. From expert insights to real-world success stories, every episode is designed to inspire action and drive meaningful change. Powered by ContinuumCloud, the only platform built for behavioral health, we're here to help you address the workforce crisis, improve clinical outcomes, and achieve financial sustainability. Ready to make an impact? Let's dive in.
Welcome back to the CloudCare Podcast, where we explore innovations shaping the future of behavioral health. I'm your host, Bob Bates, CEO of ContinuumCloud, and today we're diving into a topic that's reshaping how clinicians work every single day. It's artificial intelligence in behavioral health. We've all seen how documentation and compliance can be a major source of stress for clinicians. We're talking things like burnout, et cetera, and we're going to dive into that in a little while and how can AI help with that. But first, let me introduce our two guests to you. They are our partners and also our friends as well. So they're Ross Young, CEO of Clinically AI, and then Melissa Giampietri, EVP of Behavioral Health Strategy. Our mission is the three of us are going to unpack how AI-powered documentation and real-time compliance auditing are transforming behavioral health workflows. And what does that mean for clinicians, compliance teams, and organizations as a whole? So I'm going to hit four areas, and we'll start with the why, then we'll hit the how, and then the what, and then the where. Where are we going? So let's start with the why. Across the industry, we're seeing clinician burnout. We've talked about that in the industry for years, and I've only been in it a few years, but even in healthcare itself, staffing shortages and growing administrative demands, and also the financial pressures we read about every day. So I want to start with you, Ross, and ask like the really very basic question. What made you form Clinically AI, and what problem were you trying to solve?
Yeah, that's a really big question, Bob, but I'll keep it as concise as possible. First of all, really excited to be here for you and the audience that you've built, and for customers, and really just always enjoy our conversation. So very thankful for our partnership in that regard and being here. But yeah, I'll go through the story a little bit. So I've been in technology for roughly 20 years. And my last organization have always built technology for good. And it's really what I've tried to align my technical skill set with. And the last organization, we built an AI-based application that looked for early indicators of suicides, violence, sexual abuse, and depression in children. We partnered with school districts to put that software on the devices that were being issued to children all over the country. That product today protects over 27 million children. And one of the large organizations that we partnered with, where we had found multiple potential issues of self-harm, had asked us to turn off the product. And I asked why. They said, well, look, your product has found, so many alerts and challenges within our community that we can't keep up with them. And the fact is, if we can't get to them, it's a liability to have those in our inbox. And that really struck me. It was hard for them to say, but legal had pushed that. So I asked permission to dive in why. And I asked the magic wand question, right? If I could give you a magic wand and you could make anything go away, what would it be to the users? And they said, my notes and my documentation. So in California, they have to do a Medicaid or Medi-Cal compliant note or document every time they deal with one of those alerts. And that was taking a lot of time for them. So on the side, I said, hey, if I could build an AI-based application that could write your Medicaid compliant notes and documentation for you, would you use it? And they said, well, you'd change my life. So we dove in, we built a prototype for that. We rolled it out to that school district. And frankly, they started telling all their friends. It went viral. And I got a pretty hefty cloud bill, Bob, and decided that, hey, if I'm going to pay for this, I should probably start charging for it. So with the enterprise technology experience that I've had building a product of such scale, decided to put together a team, self-fund our organization, and build our tool. Since then, we're now providing services to over 17,000 clinicians on a daily basis, and we've gotten beyond the notes, just the note component, right? We're doing a lot more of those aspects. You don't want a tool that just does one part of it, right? So we've built a suite to help administrative staff and go for every type of document and every type of provider within behavioral health and IDD that has to write documentation or case notes.
Hey, Ross, how long you been at it? So I think people will be surprised. You would think that, EHRs have been in the business, 20 plus years? How long you been at it?
Yeah, we founded the company 3 years ago. We went to market around 2.5 years ago or so. So since then, we've really had some pretty explosive growth. And yeah, thank you. And the interesting thing is that we needed to make sure we were bullseye on the delivery of the value of our product for us to grow, because we didn't take outside funding. So our customer, it was like product-led or customer-led growth, which really made us get it right.
Yeah, it's funny. Even big companies struggle with the same things, and the better ones, they come up with a list of priorities and things that they're going to be best at. It's not good to be second best at a lot of things. It's good to pick a few areas where you are the best and you're targeted and very focused in your investment, in your time, and your mission. So Mel, we didn't talk to you yet, but how long have you been with that company, and then what drove you from being in behavioral health your whole career and somebody well respected to hitching your wagon to Clinically AI?
Yeah, no, thanks for the question. And so, yeah, I've been really in behavioral health over 20 years, started out in community mental health, but have been deeply entrenched in the behavioral health EHR market for over 14 years now. And actually, have had a bit of a unique vantage point working on the vendor side, meeting with organizations across the country and looking under the hood and being able to see what they do well, where they struggle, where they're at in terms of their technology kind of capabilities. And, it's been quite the journey the last 20 years. And I would say that while EHRs create significant efficiency and are absolutely mission critical for things like getting paid, revenue cycle management, compliance, they substantially move the needle when it came to clinician burden reduction. And that wasn't the fault of the EHR, really. It was the massive amounts of regulatory requirements necessitating significant documentation across the board that results in clinicians getting burnt out and having what we call pajama time documentation, where they're doing notes till 9 o'clock at night. And so I'd actually left the EHR market and launched a consulting firm and met Ross and team in that capacity. And when I saw the solution, I fell out of my chair with several of my colleagues, right? In terms of what the solution was able to do and how it meets the sophistication of the space in a way that really moves the dial and reduces the burden by 70 to 90%, what we've been trying to accomplish, right? And so it was groundbreaking. So it was a very easy transition for me to really help elevate the field in a way we've never seen and really enhancing the EHR. The EHR is foundational, but leveraging a solution on top of the EHR that really moves the dial. So thanks for the question.
I love it. That's you started into the how, and actually, when I hear that, I go, it's mission driven. So that's the one thing I love about this industry and the people that participate. They really care. And when we have tools that help them, I mean, you not only are your cloud bills might go up. It's funny, Ross, that you say that. It's absolutely true. It's not a hobby anymore, so you got to pay the bills. But you're rolling something out, what you say, 17,000 clinicians that you're helping already. And I'm sure you have a vision of where that goes. But the objective at the end of the day is to help them out and take their job and make it easier and let them do what they do. I actually take it further and I go, and I know you do too. You folks live this every day, but I look at the people they're serving. If you've had family members that have been through these facilities or these clinics or had treatment, and you're going, if the clinician are not actually filling out paperwork or doing it at night, they can actually do what they signed up for, which is helping people out. And people that need it direly, especially post-COVID world. Can you walk through how Clinically AI actually works with, take it further, like what do you do now? And then what's your vision? So Ross, you probably pick this one up and then Mel, you help him out, but and not to I know you both can answer the question, but I love the perspective of like, I'm the visionary. And but by the way, this is what it meant when I was in the trenches doing this. But like, where do you see it going in that workflow? Because I know it doesn't stop at just documentation. It doesn't just stop at, basically compliance. There's other things that you can do. And I know you're working on a few things in the future. So I'm going to give you kind of a platform to share where you see it going and what you're working on. Okay?
Yeah. It's an interesting and meandering road. The good thing about the bad thing and the good thing about software is that it's never finished, right? You're consistently building, adding things. The question is, what's the motivation behind that? And how do you decide to do that? So to your point, the lowest hanging fruit, right, is the documentation burden. The goalpost consistently moves there, right? It's the only thing that's consistent is change with documentation, especially in today's environment. So that's one. So we want to really perfect that component for hyper-focus there and have teams that are specifically connected and going in the field and watching these providers provide care with their hearts, right? Yeah. In challenging environments, whether it's, in a correction facility or under a bridge or telehealth and whatnot. And there's the burden is on us to make that very easy to use, right? We need to make very big buttons where you can, click it, it's easy to see and use. And then the complexity happens behind the scenes. It's kind of like the duck on top of the water that looks nice and smooth, but their feet are going, wild. So we really listen to the customer and our partners and live that experience. Through that lived experience, we probe and we ask questions. What are some other challenges, right? As we start to get into the administrative and the leadership side of, hey, I'm needing to correct a lot of these notes and documentation that come out, right? I'm needing to, it's taken us a lot of time to audit charts manually to make sure all the paperwork's there, things are signed in time and whatnot. And then we watched our customers use our product to do those things in ways that it wasn't originally designed to do. And we said, hey, they're using it for this. Let's ask some questions. So as we started seeing those different use cases, we came out and productized and aligned with a better workflow of how to do chart audits, right? And empower and enable the other staff that are doing all those manual chart audits to go into other departments or provide care or some of those other areas and create an efficiency in the chart auditing component. So that's been another major source of burden that we rolled out a product called Comply for that integrates really well with the WellAgent suite. And we've learned a lot and working, with your tool in that regard. But again, that's just the beginning, right? Organizations don't want to have 15 different vendors that they use for AI, right? And frankly, one of the challenges that we've had in this industry is disparate data that doesn't talk to one another, right? Yep. You want a lot of that under the same umbrella. So there's other products you're building, such as Supervise, which is a clinical supervision AI tool that enables analysis of the last 15 sessions, for example, of an associate provider to come up with coaching opportunities, to do clinical supervision notes, to do group supervision notes. That's another area that is quite interesting. Also, the intake and referral management stuff, right? You get someone from the ER, you got a huge chart, right? You need summarization of that to get them into your detox program or your residential program, and you don't know their history or what medications they're on. AI is a great tool for that, to break those things down and prepare the staff to do intakes and make programmatic recommendations. And just really create efficiencies because to your point you made earlier, Bob, which is a phenomenal point, people didn't get into this space to do documentation. And frankly, when they go through school, they're not taught how to do documentation. They get in the field and they're slapped with 35% of their day of writing and reading and reviewing documentation. And if they get a couple of concepts, off because they met with 10 people in a day, they don't get paid. I mean, so this is a really great tool to enable sustainability in the field of users and providers that went to school that typically aren't paid at the top of the food chain, that are required all this documentation to help them sustain and provide care to the communities that they serve.
You hit on sustainability, and Actually, that's the one part we don't hit on, but when you take that work out of clinicians' hands, you make the agency or the clinic more financially viable as well. And that will go through the basically the ripple of what we call the golden thread. It's going to go all the way through to revenue cycle management before it's over. Mel, what's your perspective on this as well? And then I actually want to say, if you looked at AI behind the scenes, we'll talk about that in a little while. I think anything decision support, and to your point, if you're looking at workflows anywhere within an organization or any platform, you can use AI. We use it for quality assurance now. We use it for documentation. It's just the next evolution of technology coming out. And if you're an entrepreneur like you are, and but both of you are, if you're looking to want to help somebody make their job easier, you now have better tools to do that with. And it's going to have a rippling effect. It's not just where we are now. I think everything we do will be leveraging these tools, and some of them will be back office. You'll never see them. The objective is just get the work out of their hands and let them do what they do best. Mel, what do you think?
Yeah, no, I would say, from being in kind of the community mental health space for years, just on the ground level, you'd see folks get right out of graduate school. They would work in these environments for maybe up to 2 years before leaving the field, burn out due to the administrative burden, due to emotional toll that it takes working with really challenging populations. So, what this category of technology is able to do to alleviate burden for the sustainability of the safety net and this mission critical work that is being done in the world with the most vulnerable populations is paramount. And the use cases we're finding are endless, and in ways that this technology can be used to really augment the EHR. The EHR does a great job of, providing you with access to data, but sometimes you have to go hunting around for it. What this does is it surfaces the right data at the right time and the right workflow very quickly, summarizes information, really takes it to the next level to help inform care provision so that you're taking data and you're turning it into meaningful intelligence to drive decision support. So I think that there's so many possibilities to not only improve care, improve outcomes by making sure that, clinicians at the point of care have the clinical insights that were discovered 2 years ago that might live in a PDF buried in a client chart. That critical information is surfaced to produce better outcomes and create greater efficiency across the full delivery system so that our safety net can sustain.
Yeah, no, it's super helpful. Yeah, you actually hit on it a little bit too earlier. When I hear 70 and 90% just documentation, and then you start to pick out the other pieces, if you're a 2% margin clinic and then you get a 10% cut in Medicaid, which is probably 80% of what you do, if you can counter that with proactive measures to take work out of that clinic and allow them to be more productive, you help the sustainability of this industry and also just, individual clinics and those that provide care. Super helpful. And the other thing you hit on, and I think it's super important, is in the EHR, the value of the EHR doesn't go down, it goes up. You're enriching data and providing that back and saying, so when you want holistic or you want better care, you have better insights into that patient. And the tool that you're using or you're providing which will be a part of that ecosystem, and there'll be others out there in the future as well, like an HIE would probably be the case next, is I think you're going to see that ecosystem and expand, and the EHR is basically the database of record for all that clinical care, and it'll be shared. I think you'll hear the word interoperability, and I don't think we've talked about it enough. But when you look at Medicaid, they were forcing that 15, 20 years ago. The HIUs never really materially became what they needed to be, but I think it's coming. I think it has to if you're going to provide whole care, the vision of whole care.
Absolutely. It's been interesting watching the evolution of that in terms of the evolution towards whole person care and interoperability. There's still challenges. We have things like the 21st Century Cures Act, which requires, solid APIs and the exchanging of data. But there's practical realities that have prevented the sharing of data. And I'd say in some states, HIEs have been successful over the course of the last 5 years. But things are certainly going to be changing, and with new requirements coming down the pike. And it's for the better in terms of really, truly improving care coordination across the ecosystem.
Awesome. Well, we've done a lot already together, and what Ross has started in our my garage, in the office over my garage. How many months ago was that? 4 months ago. So thrilled to be working with you, your team, and the partnership's working really well, and we're adding a whole lot of value within the marketplace. Is there anything else you'd want us to take away from as we start to come to a conclusion on this? Like, not just a vision, but I'm going to point people to where they can come if they want to hear about clinically AI. So I think that's a big deal. In fact, we can hit it now, but what would your closing remarks be, and how would you cast this going forward?
Yeah, well, I think an important topic to cover is the transition from wild, wild west and AI to regulation, measurability, explainability, and navigating the legislative, roads and rivers that are happening today, right? We're in 5 states that have passed legislation as of today. And you're going to see legislation, I think, across the board, in governing, these tools. So, organizations can't just take a random AI model and throw transcription on it and say, hey, I got a clinical tool. And also AI, masking poor quality of care, right? There's startups popping out, left and right. And the regulation needs to be there. There's a balance. There's a pendulum swing that needs to govern these organizations that may not have, that may take some shortcuts, right? And that could put organizations at risk and affect the integrity of the payer system. So I think it's important that the workflows inside of these tools prioritize administrative leadership and clinical and provider judgment over the AI reasoning. It's an assistive tool. It's not a replacement. And I think that's really key. And that's where a lot of the fear of AI comes into play. So really looking at those workflows to make sure that the provider and the organization is in the driver's seat is key. And as you get 100 calls a week from AI companies and the provider organizations that are listening, there's certain standards that you need to hold us as vendors accountable to, right? We see a range of provider organizations that have a very detailed process of how they evaluate technology, and others that say, move at the first, kind of shiny butterfly that flies by. And that's an important distinction and range. And one of our missions is to educate the market around making the right choice. There's a boot for every foot across the board. So I guess, as you mentioned, our company and our organization, I think that we should be in the running in every conversation. Do I think that we should win every single opportunity that we're in? Probably not. We've told organizations, hey, we may not be a fit here. And there's reasons for that. But that's an important component and humble position I think vendors need to take, but also many won't. So it's important for the provider organizations to challenge companies like us.
That's actually a good differentiator. I'm sorry I interrupted you. I was sitting on my chair, and an important part of your differentiator and ours as well is you should have an AI policy, and your employees should know. Like, it's having an AI tool, could open you up to HIPAA violations, to security violations. It can get you into legal problems for diagnosis, things like that are governed by state and federal. So I totally agree with you. Not just the policy part, but you're paying attention to what you're doing and what states, and making sure that we're not doing things that are not, I'd say, not illegal, but things that are against the regulations that are out there to protect the providers and also to protect the patients, which is a big darn deal. And we're going to see a whole lot more. We all talk about AI like it just happened yesterday. These tools have been coming for a while, and now they're popping out everywhere. Somebody sent me a list of 5 the other day and said, you got to look at these. And I said, I've seen all 5. What about the other 35 that I've seen over the last 6 months that are just popping up with new solutions? Just be careful. I would say it's a great thing to do, but you just can't jump on any wagon. You got to find a good partner in that.
Yeah, no, those are all great points, Bob. And, one thing you and I talked about at your conference that I wanted to bring up that seems counterintuitive, but is really a reality, is that AI actually makes us more human, enables us to do the things that our brains were ordained and designed to do, which is help people and interact with people and be social and critically think. The AI can handle a lot of the administrative burden. And if you can get a lot of that off your plate, even outside of this field, automating, things like your email or bill pay and taxes and running errands for us, right? With Instacarts, no rolling out robots and, things of that nature that enable us to be more human is really the positive side to look at AI. And we're seeing that in reality to create more sustainability in the space to help with the shortage and to help people.
And one of the things, and probably, Mel, if you could help out with this one, I look at things like measurement-based care that people have been talking about for a while, or value-based care, and certainly jump in, Ross, as well. But drawing out, I think there's other areas that we're just starting, like revenue cycle management too. I just go across the board and think of the things where people are staffing and they're not making the headway they need to. And I'm just wondering, do you see AI helping drive that as well? I personally do, but I would love your thoughts.
Yeah, no, I absolutely think technology can be an important conduit to really supporting all of the triple aims, right? In terms of improving care across populations, improving the bottom line in terms of creating efficiencies, and, et cetera. And there's many different ways it can be leveraged, but it needs to be leveraged in a responsible way across the board. It gets a little trickier when it starts delving into clinical decision supports, as we know. But I think that there's absolutely ways to be able to leverage it that are responsible and can not only improve efficiency, but also just improve care and outcomes.
Yeah, the responsibly part. That's why I was, basically pointing it towards you. And I'm sorry, Ross. Ross can answer it, I know, because we talked about it. And I do think revenue cycle management, when you look at 15% or 12% leakage, that's a big deal. That will keep clinics. So we talk about the financial sustainability. That's another part of that, right? Well, if you're doing medical coding after you've done compliance and then you're sending that over and you're basically looking at why things are being denied, that's a big deal. And that can help. But if you do that wrong, you can cause problems as well. So that's, I think that's the balance of make sure that we're providing the tools that people need, but also within reason and with respect and responsibly. Responsibly is the word, I guess, of the meaning. Anything else you'd want to take away from? So, thank you very much for joining us. What we're seeing is we want to give time back. We want to help. It's our mission as well. I think everybody here, it's our mission, and everybody in this ecosystem. There's plenty. I've heard Ross say that many times. There's plenty of room for people at the table within this industry. We all need to be serving and doing the best we can, and the best solutions will end up winning as well. But ultimately, compliance and providing greater quality of care is the mission or the reason for the season. Big thank you to Ross and to Melissa Giampietri. Did I get it right this time?
You did.
Okay. I'm getting closer. If you'd learn more about if you want to learn more, go to ContinuumCloud.com/clinically AI or schedule a demo. You'll see us at all the trade shows. Thank you very much for joining us. I thought very helpful. And we're looking forward to catching up on CloudCare Podcast number 6. Have a good one.
Thanks so much for tuning in to this episode of the CloudCare Podcast. We hope you found value in this episode. If you're enjoying the show, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. For more information on Continuum Cloud, the only platform built for behavioral health, feel free to visit our website, ContinuumCloud.com. Once again, thanks for listening, and we hope you'll join us soon in the next episode of the CloudCare Podcast.